Pick up the phone and call us. Hey, Dr. Jen, yeah, I know you said this thing on my whatever was going to go away, but it didn't. It did not go away. I need your help, okay? If I were the patient and you were my doctor, and I'm telling you that I've developed some abdominal pain, and you ask me, well, how long has it been going on? And I say, well, not very long. What would that mean to you? What does not very long mean? Does it mean some hours, some days? Does it mean minutes? Does it mean weeks? Does it mean months? What does that mean? Well, your physician might be wondering the same thing. One of the best things that you can do when you're talking to your doctor is to talk to your doctor the way they've been trained to gather information. Now, don't get me wrong. I'm not saying it's your job to do the doctor's job. That's not what I'm saying. As healthcare providers and as doctors, it's our job to take care of you. Our job to figure out what's wrong with you. Our job to work with you to help you be healthy. However, there are ways that patients can talk to doctors that may help facilitate this. And the first way is to be as specific as possible. That is right. Be specific and tell us details. Why? Because it's helpful. Why else? Because that's actually how doctors are often trained to get information. I teach a class for third-year medical students, and what do I teach my students? I teach them to use mnemonics or phrases that help them remember what questions to ask. They have a mnemonic called OLDCARTS, OLDCARTS. Many med schools use this. It reminds the student to ask the patient, well, what's the onset? What's the location? The duration, the character, the aggravating factors, the relieving factors, the timing, severity. These are prompts to remind the doctor and the med student what to ask. And you see, it's almost in list form like that. What can be helpful as a patient is to tell your doctor information about what's going on with you with specific details. Tell us when exactly it started. Tell us if it happens all the time or not. If it's pain or sensation, describe the sensation. Is it pain? Is it burning? Is it numbness? Is it pressure? Is it, what is it? And then describe it further. Is it dull? Is it sharp? Is it crampy? Describe where it is. Does it move? Does it stay in the same place? Tell us every single thing you can think to tell us about what's going on with you. Because that's going to help us not only figure out what's going on, but help us understand the full story. And sometimes as a patient, I know because I'm a patient myself, it's hard to think about these in terms of specifics, but be as specific as you possibly can. All right. Number 2, how to talk in a way that your doctor will listen to you. Pick a couple of things to talk to your doctor about when you go to see your doctor. Rather than coming in expecting to talk about your whole list, bring in your whole list to the doctor and say, look, doc, I got a whole long list of things. This is my list you want to see, but there's 2 or 3 that are really at the top of my list. And you and your doctor can decide what the most pressing, most important things are to deal with that day. So you can prioritize, okay? Come in ready. Come in with the list. Come in organized so that we don't leave something out that shouldn't be left out, and that we also don't leave you walking out the door feeling like, well, what just happened? We didn't even talk about what I wanted to talk about. Don't save your questions to the end. That's right. We often call it the door handle question. This really should be an exchange. As your doctor is talking to you about whatever symptoms you're having, whatever conditions you're dealing with, diabetes, heart disease, whatever it may be, ask your questions as you are going through that dialogue. Don't save them up to the end. By the way, when that happens, I usually just think the patient doesn't have questions. So ask me as we're going through, number 1, so I can address them in a timely manner. Also, so I can address them, period. Look, if we're not able to get to everything, I might need to bring you back to continue answering and addressing some of your questions. It also allows for a better dialogue, allows us to know what's on your mind, what you're concerned with, what's on your heart, and things of that nature. It helps us hear you better. And I would say the last thing is being persistent. And by the way, there are plenty more ways to talk in a way that your doctor hears you. This is just 4 to get you started. But being persistent is very important. Saying things like at the end, okay, doc, so you want me to get this imaging, these labs done, and then what should I do then? Did you want me to come back and see you? Will you call me with the results? Be persistent in finding out the plan. What's happening next? Also, be persistent if your symptoms don't go away or if the problem is not resolved. Pick up the phone and call us. Hey, Dr. Jen, yeah, I know you said this thing on my whatever was going to go away, but it didn't. It did not go away. I need your help, okay? Be persistent. Hey, doc, I didn't get that prescription that you said you would call in. Hey, this is not better. Hey, this has gotten worse. Be persistent. It is your right. This is your health. And once again, none of this removes the doctor's responsibility from taking care of you. That is our job, and that's the oath we took. It's not your job, it's ours. But there are some ways to help facilitate that happening in a way that helps everyone. So guys, I hope this is helpful. Let me know what you do and how you talk to your doctor in a way that they listen. Give us some tips and tricks. Write them in the comments. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. For those of you who have not liked and followed my page, I invite you to do so. I do daily videos on all sorts of stuff. For those of you who send stars, I respond personally. Thank you so much. And consider joining my subscription groups for exclusive content. Guys, I'll see you soon.